Okay, first up, everybody responds differently to a treatment. So if you imagine, we've all done maths at high school, the bell curve distribution, that there's a cluster of people in the middle with the mean or average result. There's the really strong positive outliers who've done better than expected, and then there's the negative outliers who've done less well than expected. So for a sleeve gastrectomy in Australia, the average weight loss is for people to lose around about 30% of their starting weight, or a third of their weight. So if you're 150 kilograms for the sleeve, if you're Mr. or Mrs. Average, you might lose 50 kilograms. But if you are lucky or young or fit or the combination's right, you might lose more. If you're unlucky or the timing's not right or there's other things going on in your life so you can't focus on the treatment quite as well, you might lose less. And probably maybe 10% of people who have a sleeve will lose less than 15% of their starting weight. And if you lose less than 15% of your starting weight, probably won't have a massive impact on your life and your function. You might lose a few clothing sizes, but you probably won't be able to transform the exercise that you do. Also, what we see with all weight loss treatments is that over time, the body adapts to the disruption that the treatment causes, and people regain a little bit of weight. You might lose 30%. We expect people to lose around about to regain about 5 or 10% over 5 years. So if you've lost less than 15% of your starting weight, you'll actually be more likely to regain weight. And some of the people who've lost 20 or 25% of their starting weight will regain at a faster rate. And when we look at average results for large studies, we see there's a cluster of people who fall, outside the average range. You probably need extra therapies. Now, on top of the weight loss being on a bell curve of distribution, side effects are also on a bell curve of distribution. So if you're in the middle, you've got some side effects. The sleeve, for example, makes your stomach quite tight, holds a bit of fluid at the top of it, which can then make you predisposed to a bit of reflux. But for most people, the reflux is pretty easily controlled and not much of a big deal. You've got some people who are lucky who go, reflux? What are you talking about? And others whose experience of reflux is a little more complex and a little bit less pleasant. And for those people, you need to find a cause for the reflux. And because reflux is actually always caused by something, it doesn't arise by itself. It arises because of an issue related to fluid and pressure flow. So basically, if the pressure in your upper stomach is greater than the pressure in your esophagus, fluid will leave your stomach and go up your esophagus. So the normal stomach has a very low resting pressure. What we measure these things in millimeters of mercury, so your blood pressure might be 120 systolic pressure. The pressure in your stomach is sort of 5 or 10 millimeters of mercury. The pressure in your esophagus is easily maintained in most people above 40 millimeters of mercury. So if there's fluid in your esophagus, it just gets squished into the stomach and doesn't come back.
Yep.
The problem with the sleeve is because it's tighter, when you put fluid and food into your stomach, the pressure goes up. And it's possible then for things to be reflected back up. But for most people, anything that bounces up into their esophagus when they eat and drink just falls back into the stomach again when the stomach empties and they're fine. But if your esophagus is weak, because it doesn't have much power because the muscle's weak, or if the seal separating the abdomen and the chest is broken by a hiatus hernia and the stomach slipped up into the chest, or if there's a narrow point or asymmetry in the stomach, so your stomach behaves like an hourglass, those three things will lead to increasing reflux symptoms for that individual.